Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. For today, we will continue with the session of therapeutic communication. So we start with communicating with the client in a stressful situation. It is chapter 20. So the objective that we will cover in this session are four objectives. The first one, we will define the stress and associated concept related to stress, discuss stress assessment strategies, then describe the stress-related strategies nursing can use in a stressful situation and stress management, identify the stress management therapy and how it can be done. So the first objective that we will come to is definition of the stress and associated concept. What is the stress? What we meant by stress? If we come to stress, it is a natural, physiological, or psychological, or spiritual responses to presence of stressors, to something that trigger the anxiety within the patient or the stress. Stress feeling sit in if there is a real or a perceived threat. So it might be due to a real threatening condition or a perceived threatening that you are expecting that some threatening is coming. It will turn off when danger is past. Stress, it is a state of mental and emotional strain or tension that result from adverse or very damaging circumstances from a stressor. We call it a stressor. So the stressor, it is demand or a situation that initiates or the initial stimuli to stress or circumstances that threat a person, personality, or security or self-integrity. So a stressor is either a demand or a situation that we will be there within it, internal stimulus might be from inside, or circumstances that it will lead to the feeling of threatening the person, personal security or self-integrity. So it might attack the security or the integrity of the person. The stressor defined as demand, situation, initial situation, or circumstances that threat the personal security or self-integrity, as we said. There are many types of stressor of that initiate stress feeling in the person. One of them, the classified as catastrophic stressors, like in case of war or hurricanes or earthquake. So that affect, it doesn't affect only the person himself, it affects the an area or a community or a village or a city or a country. So it affects all of the people. So in this case, it affects also major life changes, and the other type of stressor, we have major type life changes or developmental stressors, which is related to either marriage or divorce or death of a person moving to a new area or moving to a new situation or a new stage of life. Like here nowadays, you know that all students they are sitting for the 12th grade assessment or examination, which is considered as a change of life. So the second step of their life, it depends upon the result. So it is also from a kind of stressor that it is within the life changes, that it is a stage from the school to university or to the working life. Or it might be minor hassles, like sometimes when you are during traffic jam, are you happy during that? You will feel some stress. So it might be due to traffic jam, child misbehavior, when your child is misbehaved, when you have something related, might be computer crash, and you are unable to use your computer. So it will lead to some kind of, it is a stimuli that will lead to the bad feeling and the consequence of the stress. Stimulate and intensive stress response. So those conditions, it will stimulate the stress responses. The stress responses also depend, it's different from person to other person. Characteristic of stress, we have what we call it the eustress. Eustress, to describe a short term, it is a short term stress, mild level of stress, act as a positive stress responses within the protective and adaptive function. So that type of stress, it is a kind of stress that is mostly can be tolerable. Mostly it is a stress that it will initiate the person to do something and doing it in a proper way. So because of that stress, so it is what a positive kind of stress, perceived as being within the person's ability to manage. So it is within the personal ability to manage it and to overcome that stress. So the study, it might be when you are studying, it is a kind of stress. Because of that kind of mild stress, it will push you toward studying and understanding the material. So it is a kind of competitive sometimes. And it might be a disaster. A disaster, it is a negative stress that causes a higher level of anxiety. So higher level of anxiety will be there, perceived as exceeding the person's coping ability. So here in the stress, it can be within the patient's ability to cope with it. They can do their activities of living, they can do their function without any effect, and or it might also enhance them to do their work in a proper way. But here the major stress, it's perceived as exceeding the personal coping ability, and in this case it will affect also all the function of that person, according to the also to the level of that disaster and according to the experience the previous experience with it. Unexpected being and experienced being unpleasant. So it is an unpleasant feeling, an unpleasant experience. No one is preferring to have that kind of stress. It diminishes the performance of the person. So the performance of the person, it will come down. He will not be able to perform the task which is usually he is doing it. He will not be able to perform it properly as before. About the level of stress, there are many categories of stress, and here they divide the level of stress to four levels. The first one, which is the mild stress. The mild stress, it can be beneficial for the person. It is needed actually to have some mild stress which will push you toward achieving your objective. So it helps the people to stay focused and alert. So that stress, it will make you alert and increase your alertness and ability to control the condition which is around you. Severe, or serve as a motivator to develop a skill. So it will motivate the person toward developing his ability and his skill to meet the challenges. So it is considered as a challenges and to accomplish the goal. So it will push the person toward achieving his goal. It is mostly coming in everyday life that you might have some kind of stress that will push you toward achieving your goal. Then the stress, it might be moderate stress. The moderate stress occurs within the presence of frustration or conflict over inability to change a desired outcome through their own effort. So in this case, more susceptible to illness. So in this case, the person, this level of stress, the person may not be able to concentrate properly and to deal with this condition without help. So he might be in need for a help in order to, or guidance in order to come out of that stress. So it is more than the mild stress. The chronic one, chronic stress, it is implicated in the development and the exacerbation of cardiac condition, migraine, digestive disorder. So it is a chronic problem that the patient is having. Create balance between physical diseases and mental disorder. So it is combined between medical disease and the mental condition and mental disorder. So especially when the patient is diagnosed as a chronic illness, renal failure, like coronary heart disease, or in this case, he will think of, it will affect the life, it will affect the performance, the disease itself, and also it will affect, he will think of, do I be able in the future to return back to normal level or not? Is it, there is also other fear that, is it going to lead to death or those conditions? The higher level of stress, which is interfere with the personal ability to do the function, so the person will not be able to do his function because anxiety reduces the person objectivity. So he will not be able to see the or deal with the object with his objective. People have trouble also in versing or possibilities to waiting option, and they are unable to weigh the options that and to make a choice and to take an action. So here he will not be able to do anything in a severe condition. He will be dependent. So it is not a guidance here, it is a dependency. It is a high dependency. So the person when he is having a high level of stress, he is in need for someone to take care of him and to take the decision instead of him, and to decrease the level of his stress by also controlling that stress through medical intervention. The second objective, discuss the stress assessment strategy and the factor that influence the impact of stress, which is there in your book, page 399. Magnitude and demands of the stressor on the self and other. So we have to see how the demand is, how he is evaluating, how the person is evaluating the stressors and or that demand, how it affects them. Does that person having multi-stressors, or is it one kind of stressor? Meaning, if you have only one stressor or one thing that you are think of it as a stressor or that make you unpleasant feeling. So in this case, it might be easier to overcome it and overcome that problem and to solve it. But if the person is having multi-stressor at the same time, like he is sick, he is going to the hospital for treatment, diagnosis also, it was a severe kind of illness, like he diagnosed as if he is having cancer, and at the same time, when he came back in his car, he made an accident. So there are multiple stress at the same time. And during that accident also, there might be injured also of one of the family member. So do you think that if he is dealing with his illness only, it will be less, or he can control that his level of stress easier than when he is having multi-stressor and accident and other family member is having an injury? So suddenness of a stressful situation. When the stressful situation is coming suddenly, he is not expecting that. Like crashing or accident, death of son during an accident. So it is a sudden thing that is not expected. He was going to his work, doing normal life, and suddenly he informed that this has happened. So it is, but when it is something is gradual, like even the disease itself, when it is coming gradually, he is expecting that the situation, it might be changed and it might be worse. So dealing with that, it will be better. Accumulation of stress and the duration of the stress or demand. If the stress also for a long period of time, we have to deal with that. level of social support available. If you are having a problems and you have many people who are around you and who are ready to help you, in this case, you will feel relaxed. Whatever the kind of stressor is, but this thing, it will give you some relaxation, that you are supported. All of those people that are like to help you are present here to help you. But if you find yourself alone and no one is supporting you and no one is willing to give any kind of help, so how is your feeling in this case? It will aggravate the level of stress. So this will aggravate the level of stress. The previous trauma also, it has two things. Either it gives you an experience with dealing with stressors, and it gives you a way of management, so you might be able to manage that stress if it has some relationship with the previous trauma, or it might be added to the level of stress. So you have stress from the previous trauma, it is still unresolved, and now the accumulation of another stress and another trauma. So in this case, it will might aggravate the problem. The presence of a co-occurring mental disorder. If the patient is having a mental disorder also with that, so in this case, it will aggravate the problem. Developmental level, so we have to see if the patient is having any mental disorder, either before or which is associated with the stressors. Developmental level of the client. So we have to check the developmental level of the client, and according to that we have attitude and outlook of the client, how he behave regarding that stressor. Knowledge, so what do he know about that stressor, dealing with that stressor. Expectation, what did he expect, the consequence of that stressor. And realistic picture, is he taking the realistic picture of the stressor, or he aggravate the problem, or he is magnifying the problems of the stressor? Because also the stress, it might be a mild problems that the patient might need a minor intervention to solve it, but some of the people, they are magnifying things, and they are seeing that it is. So how did he perceive the stressor and the stress? In stress assessment, when we receive a patient with a stress, we have to welcome the client and family and let them to tell their story and concern. So what's their concern, and what is their story, what is their problem? We can assess that. So we will tell them to let us know from you, what's your story, what's happened to you, what do you feel, how we can help you, what thing that needed to be, do you need in order to make the thing and life better. Stressful event that they are having, is it a past stressful condition? Is it a current condition? Is it current financial? Is it related to income, related to financial issues? So, because if it is related to financial here, we can find another option, which is the financial, it might be financial support, or the impact of it, it might be also, it will affect the, it has an economical impact and financial impact. And so in this case, we have to ask mostly open-ended question about the changes in a daily routine. What is the changes of daily routine after the stressors? What is the new role that is you are doing now? Now, let us say even if the father is sick, the father, he might be only the only source of income for that family. He might be also the only one that they feel that he is giving support to all. He is taking the whole responsibility. But when he is sick, he is might be admitted to the hospital. We don't know if this will be for a long period of time or a short. They don't know that if it is for a long period of time or a short period of time. So there is a new role for the family members. The role of the father that was be taken by the father, they have to take it and distribute it among the family member. And who is the one that will take and who will be taking care of the father who is at hospital also. And the other consequence of that, illness, sometimes even the income is not coming now. And also he might not have an insurance. So he has to pay for the hospital and for the treatment. So there are multiple things that might affect the person during that period. Understand the diagnosis and the treatment. So the patient also in the assessment, he might not understand what is his diagnosis properly. His fear, it might be as magnified as we said. The treatment plan also, he don't know, he might not knowing what they are going to do for him, what kind of investigation, what kind of treatment regime that he has to follow. Is he able to do that or not? So we have to explain for them the diagnosis and the treatment plan for that person. And we have to assess that. Pay attention to the cultural values of culture and values of those people, and how the impact of it on this stressful condition, and is it impact is positive or negative impact. Initial assessment, so identification of the stress factor that the person is experiencing. So we have to ask what's the patient concern here. Perception of the stressor, how the patient is receiving this stressor. Is it harmful condition? Is it a threatening condition that either threatening his life or threatening the life of his family? The values or meaning attached to that stressor. What that stressor mean for him? What's the values that is given to that stressor? Does it mean it's the way of toward it, the way of toward loss, the way of, so we have to see the meaning of that in our client. Identification of usual coping strategies and methods used. So we can ask the patient, what is the thing that you are doing in order to overcome this problem? Does it work? Is it beneficial? And assess that. Is it the thing that usually can be helpful in this situation, or we have to change the plan? Assessment of linked of issues such as developmental stage, culture, family. So assess the issue of also, is the stressor related to developmental stage? Is it due to pregnancy? Is it due to the problem of getting married, a problem of changing work, or losing work, or losing family member, or losing spouse, that if husband died, if the wife died. So understanding and the person understanding, the family understanding, and level of the support from the family. Is the familiar support or not? Identify the source of stress in healthcare. In healthcare system, usually stressors are there within the our clients. So they might fear of death. It might be uncertainty about client outcome. What is the outcome of the disease? What is the consequence that might lead to? So he might fear of death, that this condition, it is definitely the end result of it is this. While all of us, we are going to die, there is a time for that. We don't know it. It is not related, it is not linked only with the disease, but also the change in role of the client, what he was doing before, what is his profession before, and now he is sick, he is having the role of a sick person. Disruption of family life, how this problem affect the family life of that person after his illness or his sickness. And we know, as we said before, it might be affected in the role and performance of each one of them. They might be depending on, definitely they are depending on some issues. Is it not only the financial, and also it is the cooperation, it's what he did at home, how they feel about that. Financial concern also is there, as we said. Level of satisfaction with the care and compliance with the treatment. So is he accept our the level of satisfaction, is it accepted, or he is not feeling that it is up to the level that it should be done. Compliments with the treatment also. Some of the patients, they are not complimenting with the treatment regime. So in this case, we have to be sure that they are receiving the proper knowledge regarding that, and the consequence if they are not taking that medication, and the consequence if they are taking that medication. Physical also discomfort that the patient is having. Strange noise and light. You know, at the hospital, there are many, or at any environment, there are many noises that might not expected. In the hospital, the noise which coming from patients who are having pain, the noise that is coming from the machine, from monitor, from suction machine, also that interfere with the patient when he is want to take rest. The light that usually when the patient is a 6 bedroom bed in that room, and the nurse is coming every now, or the health care worker are coming every now and then for giving medication to other, for giving care, for taking observation and vital signs. So it is disturbing also. Unfamiliar people asking personal question, and strange equipment. So the equipment which is there, you don't know for what purpose is it. It is strange for him. It is the first time that he is seeing it, and also strange people are coming. The physiotherapist is coming, the pharmacist sometimes are coming, the dietitian, the physician, and the consultant, the nurse, and different nurses are coming every shift. So and everyone is doing assessment and asking questions. Student also might be there and asking questions. So is this a stressful situation for the client? Assessment and intervention. In the assessment, we have to assess the perception of the stressor, interpersonal factors, and intrapersonal factor, and interpersonal factor, and environmental factor that affects the stressor. The intervention, which is, we will see the primary, secondary, and tertiary intervention. If we come to perception of stressors, not all of us are perceiving the same stressor with the same level. So a major stressor area or health concerns, it might be perceived for some patient as a low level of stress. They can, according to their values, according to their support, according to their beliefs. So all are affecting the perception of the stressors. Present circumstances related to usual pattern. So any circumstances that present with the client, and it is mostly with the usual pattern. Experienced similar problem, if the patient is having similar problem before, and how was it happened or handled. So in this case, he is having experience and the ability to deal with it. Either it might be supporting us with it, or it might be depressing, because if it is a bad experience, generally it is but he escaped from it within a short period of time or not. Anticipated future and consequence, how this problem will affect his future. Expectation of self-expectation. So it depends upon the self-expectation. How do he expect that he will come out from this situation within a short period of time, within a minimal loss sometimes. Expectation of caregiver. When a caregiver, also we have to assess the expectation of a caregiver, and in those things we have also to give always health education and information about the client and his problem. Intrapersonal factor, which is the person with the condition or the affection within the person himself. How does it affect the mobility and body function? Does that thing affect them? The psycho-cultural factor also, attitude, does it lead to change of attitudes, values, coping pattern, developmental, the age of the person. So factor related to present situation also. Spiritual belief system, hope and sustaining factors. So is there a hope that he believe and that even if he is having a painful stimuli or a painful condition, that it is considered as something that he will get later, a benefit from it, either in the later life or that condition. So interpersonal factor, so resources and relationship of family or significant other as they relate to or influence the interpersonal factor. So here the other personnel who are around him, how they are receiving the problem and how they are going to help with resolving of that stresses. Environmental factors also, resources available within the family, within the community that will be helpful for the client and to overcome that stress. Relationship with the community, his relationship with the local community, with the work community, and how they are supporting him as they relate to or influence the interpersonal factors. So how they are related to them, how those factors are either helpful or a burden on the patient or in that condition and aggravating the stresses, or it might be the cause of the stress. So either it might relieve the stressor or it might be a cause of that. Prevention and as intervention, so there are primary prevention, which is in this case we have to classify the stressor, provide information for the client and support positive coping mechanism that they are having. So we have to empower the patient, we have to see the positive coping mechanism that he is having, the positive thing that he can apply and enhance it, educate the client and family, and give him just education that might raise the patient ability to tolerate the incident or the stressor, or to overcome it and to change their view toward the stressor and decrease the stress and manage the stress that they are having due to that. Secondary, which is mobilizing resources, so we can mobilize the resources that he is having in order to overcome this problem. We can financial resources within the community, resources we can take from others. Motivation also by education of the patient. We have to motivate the patient toward the process of overcoming the stressors, educate him how to overcome and how to be to deal with it in a positive manner, involve the client in healthcare goals. We have to involve him in the plan that it will be helpful for the client to overcome and to escape from that kind of stressor. Facilitate the appropriate intervention and external resources. So we have to be a facilitator between the client and also the community resources that are external resources within the community in order to link them, orient the client to the association, to the governmental sector, to person that might help in that kind of resolving that kind of stress, and give some kind of help and support. Prevention and intervention, also the tertiary one, which is attain and maintain the wellness of the client, trying to maintain his wellness, educate and re-educate as needed. So we have to continuously do assessment, see the educational level and what kind of lack that we want to give him more health education regarding it, in order to come out from the problem. Coordinate the resources. The resources, yes, it might be from a different association, from a different people, but it might be the same thing. So we have to coordinate between them in order to be valuable, in order to be touch all kinds of the patient need, not only to be focused on a certain need for that client. Provide information about primary and secondary intervention. So we have to provide information for the patient about primary and secondary intervention that should be done, and from where it can be done, and how it can be helpful for the client. Behavioral observation also, we have to observe the change in his eating and sleeping habit. So the person, when he is under stress, some people they are eating too much, some people they are not eating at all, most of the people they are unable to sleep. So how that affect their activities of living, and how we can help them if they are having difficulty or insomnia. So how we can help them to sleep well and eat well, even when the use of some either they are using tranquilizer for the client, or pain relievant, headache. Mostly the patient with stress, he will have headache, gastric problem also, muscle tension, ache and pain, tightness of the chest and throat, and if the level of the stress is high also, those conditions it will be aggravated, and if it is not resolved, if it is very severe stress, it might lead eventually to death. Restlessness and irritability, we have to observe the restlessness and irritability for the patient, the client, and we have to control it. Inability to cope with normal everyday concern and obligation. So is that stress make the patient unable to do the daily activity and the daily obligation that is required from him? Inability to concentrate. He is trying, but he is unable to concentrate on what he is doing. In this case, it will increase the possibility of injury. Anger, hostility, feeling shame, feeling embarrassment, dread, and also social withdrawal. Withdrawn from he is not accepting to talk with other, he is isolated. Inability to recall information. Some people they are unable to remember what's happened after that event. Block speech, unable to speak. Fear of losing control, unable to control what is going around him. So they need additional information and frequent support delivered in the to calm and complement manner. So according to the state, we have to do the intervention in order to control those patients. The most common stressor emotion, feeling helpless or psychologically threatened. The patient might feel helpless, that he cannot do anything. There is a threatening that threaten him psychologically, threaten his life. Blame is frequent also form of hostility, such as criticizing the nurse for not responding to him quickly. So in this case, they are trying to put their stress over leaving the nurse. They are not responding within a period of time. So they want the nurse to be on their head when they are calling immediately. Nurse need to remain here empathic and allow verbal ventilation within reason. So she has to listen to their complaint. Let them evaporate. Use open-ended question to let them come out with what stressor is there, and they are trying to suppress it, to raise it up. By that, they will feel some relaxation. Set limit for necessary, if necessary, within a calm attitude and manner. Yes, sometimes might be intolerable, and in this case, we have to set the limit between us and the nurse and describe and identify your role and responsibility, the thing that you are able to do and the thing that is not in your hand. So they might demand something that is not in your hand, that it is from the physician or from other health worker. So in this case, we have to calm the patient and assist him, listen to him, and tell him what you are going to do in order to help him to overcome this problem. Carefully listening to a client concern. So we have to listen carefully to the client and being attentive. Assessment of coping skills, also ask about the coping strategies client has used in the past, so we can assess what did he use in the past and what the person is currently using to resolve this stress. Is it beneficial? What kind of thing increase your stress? So what is the thing that is increasing the stress? How we can avoid it? What is the laser action do you engage in? So what's activities that you are doing? What do you do to relieve those stress? Is it beneficial? What are your usual method of coping when you do not feel stress? When you do not feel the stress, so what's the usual method of coping? Nurse should ask those questions using an informal conversation format. So it is coming with the consequence of interview and discussion with the client. Client will feel more comfortable if they're present an open or not telling stance and calm attitude. So if he feels that the person who is communicating with him is calm, with calm attitude, is, in this case, and non-threatening stance, in this case, he will be open and he will, this will relieve his stress. But if he feels that we are threatening him as a nurses also, and we are using high pitch sound when communicating with him, we are not listening to him properly, in this case, this will aggravate the problem. Assessment of immediate social support for the client. So asking question about how the client and family is coping with the current situation, provide useful contextual data for the patient. Does the family perceive the stressor in the same way that the client is perceiving it? Have important issues being discussed fully with the family? How or to what extent are the family value the challenges by the current situation? How did they feel about that? Are they feeling the same? Are they feeling that it is a problem or not? How might the family and the client work together to improve their stress management skills? Are they helpful in dealing with the client problems? Are they supporting him in dealing with that? Are they having a positive attitude toward that? Is it helpful or not? Are the family member and the client communicating with each other? So, is there any communication, or they are leaving the client alone? Family willingness to be involved also. What are the expectations of care? They might come and ask what we can do, how we can help, what kind of help that we can do it, how we will be a helpful person for that client. So in this case, it will show their willingness. Why? Way of expectation are different also. So how they are expecting, what did the expectation after this problem? Are they expecting improvement, or the thing will be worse? What's the need from the nurse? What the family are in demand from the nurse? How is spokesperson in the family? Who is the spokesperson in the family? Who is the one that we can give him and deal with him properly? Cultural and religious and family values and concern. Also, it will be either helpful or not. Identify the source of strength and hope. So women solicit and support and directions. So how they support their children, how they support their husband, turn to their good God and higher turn toward their God and higher power by dua. How they are turning that toward that, how they are believing with that, are believing that it will be helpful or not. Family and friends also, and how they are feeling and viewing the problem. Community resources, support group, and if they feel that yes, this is a person that they can under their concern and they can help them for that. Social services which are available. Assessing and providing spiritual comfort for the client from religious people. Reading Holy Quran also. From so we might have someone who can also help the client with that religious beliefs and increase that and relate it to the problem and how we can deal with that problem. Nursing intervention to decrease family anxiety. This is present in table 22 in your book. Identify the family spokesperson and support person involved in the decision making. We have to involve them in the decision making. Identify primary nursing contact for the family. So always it's better to have a contact with the family with a one nurse. Discuss the family access to the client. So also we have to discuss that with our client. Call the family about any change in the client condition or treatment. So we have to call them and we have to discuss with them any kind of change in the treatment plan and in the patient condition. If it is toward worsening or if it is toward improvement. Provide complete data in order to this is in order to make to be trusted and by the family. When you are giving the truth for them, when you are telling them about the condition and the changes on the condition, then it will come to the more trust. Provide complete data and easily understandable term. So use an easily understandable term for the family and for the client when you are telling them about the treatment plan and about their condition. Actively involve the client and family in all clinical decision. So in all clinical decision, we have to involve the family and let them know and let the patient know about all the decision regarding diagnosis, regarding treatment, regarding the all of those conditions. Considering the stress issues for children, they lack of the word and expression to sort out the meaning of the illness of stress, especially in young children. Express their stress through behavior, academic decline, so then it might be through they are not achieving well in the school, gastric disease, headache, in hospital, child withdrawn, so he is trying to be isolated and not to be engaged with other children or with the nurse. He didn't want to talk with the nurse or with the physician. Demonstrate clinking behavior or having frequent meltdown. In this case, nurse should base their responses and detailed knowledge of the child cognitive and psychological development as well as concern data about the patient. Answer all the child question on a simple, honest way. So she has to answer, or the health worker, they have to answer the child question honestly, but with a simple language that he can understand it. Encourage the child to express their stress feeling through drawing. We can give him papers and pens and colored pen in order to draw, and by that it will decrease the level of stress, might decrease the level of stress. Manipulate the puppets, and manipulating of that kind of stress. Considering stress issues for older adult, change in lifestyle and financial stages or status after retirement. So it is one of the issues. Loss of spouse, loss of wife, fear of not being able, loss of wife for the male and loss of husband for the female, fear of not being able to live independently. So because they are used to be living together, now he is alone move to an assisted living or nursing home. If the person, the old person is moving to daycare or a hostel for caring of geriatric person. So in this case, we have to maintain an active social life and healthy lifestyle for the client. So keeping him in contact with his family member, and also healthy lifestyle, doing exercise, the type of diet that's healthy for him, sharing concern and developing leisure or volunteer interest. This will help to develop the harmonious lifestyle. So he can share also in after retirement in leisure time and doing volunteer work for others. Now we come to describe the stress reduction strategies that nurse can use in stressful situation. So the stress reduction strategies, we have to provide information. Always, most of the stress due to lack of information of the client. Lack of information regarding the consequence, the progress of the disease, the treatment plan, operation, result of the test, diagnostic procedure, how it can be done, and the consequence of that. So always we have to provide information and give a full explanation in a simple way that the client can understand. And what is the consequence of that? Processing a strong feeling. You have to deal with the strong feeling and to manage it. Anticipate guidance. Anticipated guidance if the patient's level of stress is higher and he cannot control or do what is the thing that he has to do. In this case, we have to guide him to the solution, to what he can do. Supporting client effort when the patient is trying to do so, we have to support him, help him in doing that. Promoting healthy lifestyle by exercise, by taking good food, by engage themselves in doing some beneficial activities for themselves and for others. Helping family to handle the stress. We can help the family to handle the stress properly. So providing information such as visiting hour, time of test, procedure, plans for discharge, patient condition and treatment. So all of this thing, it will help the client and it will decrease his stress, because the stress it might be due to that. Begins during orientation patient and family to healthcare situation or institution and or unit. So it has to be from the beginning of entrance to the institution. Briefly explain the following. What will happen during test or during surgery? What they are going to do? How it is likely to interview the client and the way of that. So and how the client can be cooperative or assist in the treatment procedure. So who will interview you there in the clinic or in the operating theater? How you can assist them in order to do the procedure in the proper way? What's the position that you have to be in? So this information, it will be helpful and it will decrease the anxiety. Like if the patient is going for a diagnostic procedure for a kind of X-ray and he don't know what's what is expected from him. We are taking him, just we told them that there is a diagnostic procedure in the X-ray department, and we didn't tell them what's the expectation, how that will be done, what kind of thing, which position it will be, is it while he is lying down, is it while he is standing, do he have to move, do he have to control his movement, do he has to control his breathing, so all of those things. Is there any sound which is produced from that machine or not, like in case of MRI, because it is producing high sound, so the patient might get terrified from the sound of the machine. The patient might get terrified from the closed system of CT scanning when he is going inside the machine. So we have to tell him from the beginning what it is the expectation. In a stressful situation also, information and direction must be repeated after 48 hours, because we expect that the patient might calm down rather than in admission. Provide written instruction that can be discussed among family members to enhance understanding, their understanding. Allow the family member to have contact number of the healthcare provider. So we will provide them also with some written material that they can read, and also we'll tell them that Mr. So-and-so or Miss So-and-so will be helpful, and you can contact them if you need any further information. Processing strong feeling. Give them opportunity to express feeling and thought and words. Let him evaporate, let him talk, listen to them, listen for them carefully. Example statement. This must be very difficult for you. Can you tell me what you are experiencing right now? What's your feeling now? How you are will deal with it. Allow the client to be in a charge of area and issues that are not odd with the treatment protocol, and help the client to discover real causes of their frustration. We have to let him understand the real cause of his frustration and stress. Anticipatory guidance, the process of sharing information about the circumstances and concern or a situation before it occurs. Also, fear of unknown intensify the impact of the stress, because if the patient don't know what's going on, what is going around him, he is feeling that he is uncontrolling the environment. Knowing what lies ahead can prevent development of crisis. If we are knowing what is the expectation, in this case, we can avoid it. Being honest and communication is essential, but it's sensitive to client experience is critical. Sensitivity is critical sometimes. Do not offer more than what the situation dictate you. So you have offer according to the situation, according to what is expected. It should not be more than the usual thing that we have to provide. Encourage the client to expand suggestion rather than presenting a full plan. So you can let him speak. What's your suggestion? How it can be resolved? In your opinion, what we can help you, and how you can help us in resolving this problem. Helpful in preparation family member for their or first visit in the client. We have to be helpful for the client, for the family member to visit when they are visiting their client, and we have to give them instruction before and give orientation to the case before that. Supporting client effort without a command over controlled part of life, people feel helpless and stressed. So we have to develop a realistic plan for offset stress and deal directly with the obstacles that prevent us from continuing our normal life. Evaluate the each action steps, and make the need modification for each steps of care. Promoting healthy lifestyle. In promoting healthy lifestyle, we have to good healthy habit to improve stress resistance, and eating healthy diet, avoid emotional eating, and the wrong food given to people sense of control as will be. So we have to control the food according also to the patient condition, the patient ability to give also healthy food rather than junk food. Too much caffeine and alcohol can be exacerbate the stress. So caffeine, coffee, Nescafe, tea, it should be avoided when the level of stress is more. Laughter dissolve the stress. We try to make the client positive and try to at least smile or laugh. By that, it will relieve the stress. Adequate quality of sleep also is restorative, and if the patient is taking adequate time of sleep, this will be helpful in relieving of stress. So it might be with the help of some medication sometime. Regular exercise help the body to release tension, so they can use yoga or tai chi, mediation, hiking, biking, keeping breathing or deep breathing, muscle stretching also. All of this, it is a kind of expressing or using the energy in another way rather than the stress. Organize the time and doing activity, energizer. Balance also work with a leisure. So we have to have a balance. We have to have a time for our work and a time for our leisure time. Restructure our priorities, and to start with the thing which is most most priority for us, and may delete other thing. Eliminate unnecessary obligation. If there is unnecessary thing or anything that has to be done, but it is not necessary to be done now, we can delay it. Help family to handle stress. Source of stress, it might be fear of death, uncertain outcome, emotional also, or trauma, financial concern, role change, routine disruption, change of the routine because we are used to usual routine in our daily time, unfamiliar hospital environment. All of this, they are some condition which considered as a source of stressor within the health institution. So family looks to the nurse as the source of support and direction, because mostly the nurse is having more time with the client, so she know and she coordinates between the patient, the health worker, and the family. So she is the most knowledgeable one about the client, and it is the source, mostly the source of information for the family and for the patient. Consistent, regular communication is a must with the client and the family. Put yourself in a family situation. If you are having one member of your family having this problem, how you will behave. So put yourself in that situation. In this case, you will expect what's their feeling. You will expect what's the thing that is needed from other, for that you can be more helpful for them. Stress management therapies. From the stress management therapy, we have many kind of things that can be used in stress management. From that, we have mediation, which is stress reduction strategy to develop a sense of inner peace and to center themselves. So it allows the people to decrease stress by focusing their attention on other things. So instead of focusing on the problem, they are trying to focus on other thing. It creates the mind of disturbing thought. So it will disturb the thought of the person. So from the stress and the stress factor to other thing. Mediation is a stress management tool that can be useful at many points. Example, focusing on a deep breath and muscle tone, muscle relaxation in doing exercise. So this is the thing. Biofeedback also used to manage chronic stress affecting the body system by activity, blood pressure, heart rate, pain, migraine, headache, to improve the health. Provide awareness of minute by minute changes in biological activities. So the goal is to lower the physiological arousal and promote relaxation. So how we can relax and prevent those changes. Equipment, encephalogram that can be used, skin temperature devices, blood pressure measures, galvanic scan, resistance measurement, and electromyogram measure the muscle tension. So by that, the patient will concentrate on that and the effect of it. Progressive relaxation occur, which focus attention on conscious control, voluntarily skeletal muscles. The technique consists of altering the tension, relaxation muscle group by deeply inhale to the count of 10 and hold the breath. Exhale slowly again. So take a deep breath, like if we are taking, then also exhale slowly. Again, count for 10. Continue as you do this exercise only in your breathing. Feel the tension also, feel the tension leaves the body, how the tension is leaving the body. Yoga and Tai Chi. Yoga is a mind-body exercise, so it is an exercise for the mind and the body. Yoga emphasizes the correct alignment and control posture or poses and regulate the breathing and helping the people to relax and reduce stress. Their concentration in some movement and being for a period of time in that position, they taking deep breath, closing their eyes. So the Tai Chi consists of posture or movement practiced in a slow manner. So it is practiced in a slow manner. The Tai Chi involves stretching rhythmic movement. So it is stretching rhythmic movement coordinated with controlled breathing. It is coordinated with a control of breathing. Guided imaginary also. It is technique used to combination of relaxation strategies for cancer and pain stress. Pain and stress also. It used client imagination to stimuli healing mental images designed to promote stress relief. Ask the client to imagine a sense of previously experienced as a safe, peaceful thing, or to imagine some beautiful thing. So this is the strategies of dealing with stress. Thank you for listening. Good luck.